Good evening. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for this live Facebook discussion. I'm thrilled to have alongside me tonight Dr. Maria Tsarouhas. She's a physiatrist at the Hartford Healthcare Inpatient Rehabilitation Unit right here on the campus of Hartford Hospital. Dr. Tsarouhas, thank you for spending some time with us tonight.
Thank you.
Well, this is exciting because in September we had a grand opening of the Inpatient Rehabilitation Unit, a fully functional rehabilitation unit that mimics a home-like environment right here on the campus. How has it been since the grand opening? How many patients have you helped? And tell folks a little bit about the inpatient unit.
Sure, it's been a very positive experience. The feedback we have gotten has been very good from patients. Our outcomes have been excellent. Compared to other rehab hospitals in the area, we score higher for patients regaining function and for improving their quality of life for when they do go home.
And that is attributed really to the fact that, you know, the home base is here at the hospital. Patients typically, now this is for patients with serious illness, traumatic brain injuries, who after whatever life-altering event has occurred to them, they need rehab. And a lot of times they'll have to go to another facility. So this facility is right here on the campus. Talk to us about the benefits of having it here on the campus for these types of patients.
Absolutely. For these types of patients where their status can change at any minute, having that proximity, it can't get any closer, within the rehab, within the hospital, they are accessible to their specialists for complications if they do arise, and also for consultation to address other concerns.
And these are all types of specialists too. There's folks like yourself, but there's neurologists or anybody that can come in depending on what the illness or injury is for that particular patient, correct?
Yes, that is correct. So neurologists, orthopedics, we've had ophthalmology, ENT.
And that makes a huge difference because a lot of times in rehab facilities, it's just focused on the rehab part of it.
Correct. We do focus on medical management of their comorbidities as well.
And so talk to us about the unit itself. It's a 26-bed unit right here, again, as we said, on Hartford Hospital's campus. Tell us about the unit and what it has to offer.
Sure. They're all private rooms, 26 beds, as you said, state-of-the-art equipment in physical, occupational, and speech therapy, in addition to their traditional therapies. We use technology to help patients regain function, whether they have difficulty swallowing due to a stroke, difficulty speaking, a difficulty or weakness with their grasp, their range of motion and coordination, which impacts their ability to wash and dress and bathe, feed themselves. Also, we have technology to help patients improve their walking, their balance, and transition from using a Hoyer lift, for example, to doing transfers, using a walker, using a cane, and then a lot of times no assistive device.
And I think what's unique and special about the inpatient rehab unit is that there's an area that actually mimics the home environment. So there's a kitchen, so that patients really, I mean, it's hard when you're in a hospital setting and you're in a room to sort of reacclimate patients to their normal way of life, but you're actually putting them in that setting. So that has to make a huge difference.
Yes, absolutely. The state-of-the-art transitional ADL apartment does have a fully functioning kitchen. It has a regular queen-size bed, so patients can practice getting in and out of bed without using rails, using a regular surface, getting in and out of the bathroom, onto the toilet, into the tub, and simulating real-life events. When a patient is making scrambled eggs, for example, in the kitchen, we are assessing their coordination, their ability to sequence events, assessing their safety. Do they remember to turn off the stove? All things that are part of the activities of daily living.
Yeah, that you wouldn't typically get.
Correct.
Had they not been exposed to that. In case you're just joining us here on Facebook Live, we are talking with Dr. Maria Tsarouhas. She's a physiatrist at the Hartford Healthcare Rehabilitation Unit right here on the campus of Hartford Hospital. Do you find that by having this specialized unit that on the back end it helps with readmission rates because you're so comprehensive, and by the time a patient leaves here, they're pretty much good to go, that it's not, there's kind of no questions left to maybe have them come back for readmission. Do you find that this takes care of that sort of readmission back to the hospital?
Yes, certainly. Obviously, if somebody does experience a heart attack and needs to be readmitted, that does happen, and having the inpatient rehab unit here on campus makes that a seamless transition. For patients who are improving their level of function and going home, there is less chance of hospital readmission because of the personalized and coordinated care that they do receive in the inpatient rehab unit.
And now I think it's important to point out is that the average length of stay too while they're here is quicker because they're getting all of that that higher level of coordinated care all at once, and they're in that hospital setting. So I think the average length of stay decreases, but that's not for everybody. We want to point out too. But for the average length of stay is pretty minimal.
Mm-hmm. So the average length of stay is about 12 to 13 days, but we do meet as a team, interdisciplinary team, to formulate the patient's plan of care and review what barriers there are for a patient to transition to home. What do they still need to focus on while they're in rehab before they can go home and be successful? And we meet as a team to go over those things, problem solve, address them, and help patients make that transition. Sometimes patients do take a little longer to rehab, depending on their severities, and some a little less, but 12 to 13 is our average.
And I think, and that's another important part too, is that you're constantly meeting as a whole, the group is, to reassess, because every day is something different with these patients, that things change all the time. So what formula may have worked a week ago, it might be different this week. So you're constantly trying to assess all of those patients and figure out what changes might need to be made during their stay, right?
That is correct.
Talk to us about some of the types of illnesses, injuries that would qualify somebody to stay in this inpatient rehabilitation unit.
Sure. So patients who've had injuries, trauma, motor vehicle or motorcycle accidents, gunshot wounds, amputations, multiple fractures, recovering from spine surgery, recovering from spinal cord injury, or whether they have multiple sclerosis or Parkinson's disease, brain injuries or brain tumors, strokes. We see all kinds of patients, even the debilitated patients who have had a prolonged hospital stay.
There also is a lot of state-of-the-art equipment that you have, as well as all of the monitoring that you do. But for people with these types of illnesses and these types of traumatic brain injuries, obviously there is a lot of rehabilitation that's required, but you also have state-of-the-art technology to assist in that. And that's with speech, occupational, physical. Kind of give us a rundown of the equipment that you tap into to help these patients.
Sure. In speech therapy, we have technologies to help patients improve their speaking so that their speech is not garbled, it's more clear, they can enunciate. We have technology to help them improve their swallowing function. In occupational therapy, we have technology to help strengthen the hand, whether it's functional electrical stimulation, whether it's upper extremity ergometer or an arm bike. We have technology to help with coordination and balance using the BioNess BITS machine. We also, in physical therapy, have technology to help patients with their walking, improve their gait. We do assess them for bracing if needed as well.
It has to be gratifying to you as a physician to see the patients when they first come in to when they leave. Talk to me about that feeling.
Yes, that's a very gratifying feeling because patients come in at their worst, I'll say at their worst, after they're stable to make that transition out of the acute care. And you see them leaving at a higher level of function. Their speech has improved. They're able to take care of themselves. Their mood has improved. You really get time to build a relationship with these patients and see them leaving much better than they came.
And I think for you especially, because typically without an inpatient rehab unit, you're sort of seeing them on an outpatient basis by the time you would ever see them again. But now you're actually able to see them still as an inpatient, but while they're getting their rehabilitation.
Yes, and I also see patients in the outpatient setting, so we do continue that care from their inpatient rehab stay as well.
Yeah, I think it's interesting because you're sort of there every step of the way.
Yes.
And that I think is so important, because during that rehabilitation phase, there are a lot of changes that can occur, and I think it's important to, obviously, to monitor that, but to make the changes necessary to keep them improving.
Yes.
What would you say is the biggest difference in having this inpatient rehabilitation unit, other than the things that we've mentioned? What has been the biggest thing for you as a physician? Is it easier to coordinate care with other physicians, with the patient here? What has been the biggest benefit for you?
Absolutely. If there are any concerns or any changes in a patient's status, or we need any updates in terms of advancing weight-bearing restrictions. So if somebody has had a fracture and they've been in the hospital for a while, now they're recovering in the inpatient rehab unit, we can check in with the orthopedist and get the imaging necessary to assess healing, determine if their weight-bearing status can change, can be improved, and then there's more things that we can do to help these patients recover.
And I think for the families too, because when a loved one has suffered a traumatic brain injury, suffered a serious illness or a car accident, the support system, really takes a hit, and it's so important for the family to have support as well. And I think by having this unit, they can actually be there. I think for the families, probably a level of comfort knowing that their loved one is here still at the hospital but getting rehab. Do you find that it's sort of a level of comfort for the families?
Yes, definitely reassurance, because it is the step closer to going home, but not quite ready to go home.
Right.
So this helps improve their confidence in that patient's feeling ready to go.
Dr. Tsarouhas, thank you for all the great work that you're doing, and it's so important at such a critical time in a patient's life when they're transitioning from something so serious that has happened, a life-altering event, to making such great strides, and that's all in part of what you do and the staff at the inpatient rehabilitation unit. So thank you.
Thank you.
We appreciate it. And thank you, as always, for joining us for this live Facebook discussion. If you'd like more information on the Hartford Healthcare Inpatient Rehabilitation Unit here at Hartford Hospital, you can call 1-855-HHC here. Thanks once again for joining us. I'm Hartford Healthcare's Tina Verona. We'll see you next time.